And now we spoke with the former Health Minister, George Smitherman, and we handed him a copy of this leaked draft bill, and he read through the report and he said there's a lot of opportunity here for the potential privatization of public services. Does it look like the government's moving towards privatization, or at least certain aspects?
I think that anytime that the government comes forward with a bill that leads with the word efficiency, and where they have declared in the language of the report that we can do more with less, people that are afraid of more private healthcare delivery should be concerned about what that means.
George Smitherman, a former Liberal cabinet minister, says it's important to read between the lines of the report and legislation to see where this government may be headed, particularly with the focus on integration of services.
There are greater opportunities coming for private delivery, but not related in particular to anything in the legislation, but a signal that I saw in the report.
And what he saw in the report was a move away from more beds, even in our crowded and near-capacity long-term care homes.
It's, in a certain sense, a backtracking in a significant way from the Conservative campaign platform. Especially, it seems to me, it's sending a signal that they're not going to try and build their way past aging with more and more and more and more long-term care beds.
Instead, he sees the potential for patients to self-direct their healthcare dollars, eliminating the need to go through local health integration networks and community care access centers to seek long-term or home health care.
This will work well for some families that are organized and able to self-advocate, but could be a real risk to patients or families that are less able to organize things or advocate on their own behalf. But the point is, I see a lot more money in the hands of patients and controlled by patients at the community level, where they will have the alternative of spending that money with traditional publicly not-for-profit providers or for-profit providers. I think that's one area where the private sector will be seeing more opportunity if this model goes forward.
He also expects big changes in the way that community health care is delivered, particularly when it comes to mental health and addiction services.
This is by stealth health service restructuring too, and we will see tremendous disruption in some aspects of the healthcare system, probably not hospitals like that one focused on, but at the community level. And I rather suspect that coming down the line is going to be some movement that has not depended upon very much consultation, that will be intensely disrupted in some of the community sectors. Especially, I'm watching the community-based mental health sector, which currently has about more than 400 distinct providers. And I really see a lot of language in the report that lends me to believe that there will be a big play towards much bigger entities in mental health, for better or for worse, but at the risk to some of those community-based providers. And I think a lot of disruption is coming in that part of healthcare in Ontario. Now, the committee that is examining hallway healthcare is expected to deliver a second report in the spring. In the interim, they're going to be conducting community engagement sessions across the province. So you could try to attend one of those to have your voices heard, or make a written submission to them at hallwayhealthcare@ontario.ca.